All right, so this patient, who's a dear friend of mine, has some plantar fasciitis issues. Last time I saw her was last week. We did a top-down approach. She had chronic plantar fasciitis for how many months?
Over a year.
Over a year, so it's been a long time. She's hit plateaus with different manual therapy techniques, with acupuncture as well, hit plateaus. So what we found was that she had a left anterior canal issue on the left side, left cerebellar dysfunction on the left side. I gave her some corrective exercises to fix that. Then I did some aggressive manual therapy into the plantar fascia itself, and the pain, it was how much better, would you say, percentage-wise?
About 70,
About
80.
80% better after the first visit. Then she went home with those corrective exercises for the brain. So today, because she's wearing tight jeans, I'm gonna do something called Voodoo wrapping. And this is gonna be really tight. So what you wanna do is pull the band really tight, wrap it around. And so why this works is multiple reasons. We're creating proximal and distal vasoconstriction. So vaso is vessel, constriction. So then when I take the band off, we're actually increasing circulation because it's opening up the vessels, and it's going to increase blood flow and circulation to the area. The second reason why it works really well is because we're actually tapping into specific receptors of the joint. And normally I would not do this with jeans on, but it's the best thing I have right now. Is that really, really tight?
Yep.
Good. Now the key with this is, after we do this, we want to do some sort of joint mobilization. Hold the table for me. So I'm just going to get this to go. Perfect, thank you. And then going to mobilize the soft tissue, get the joint to move while the band is on. Because when the band's on, it's interrupting the pain fibers. Then I'm activating the certain joint receptors, called mechanoreceptors, which upregulates the left cortex of the brain, which will downregulate the right cortex of the brain and create this balance between the left and right side. Because she had an inhibition on the right brain, this is going to actually activate it a little bit because I'm inhibiting the left. So it's really kind of confusing, but yet really effective. And we only want to have it on for about 30 to 60 seconds, then we take it off. And again, I would normally not do this with jeans on. Okay, now Cal, let's have you stand up and take a walk.
Swing around. Don't just do this. Okay? That's all in my knee. This is my hip.
How's that feel now?
And loading my head up.
Percentage, how much better?
Okay?
From just before, I would say
Hey, Evan's doing anything.
probably a good like 60%.
Good, 60% overall?
Yeah.
Good, okay. So that's really simple and easy to do with your patients or whomever, or you can do it on yourself at home. All right, all the best, have a good one.